Okay. Hi, everybody. Thanks for taking time out of your days to be here. Like Amy said, I've worked in policy for different policy areas and organizations for around the last 15 years. Um, I will say I do not consider myself an expert in policy, but I've learned quite a bit about how the process works, how the policy development process works, particularly here in the province. Um, but the way it works and some of the considerations that need to be thought through in the development of policy and in writing discussion papers and policy documents for government. I think these things are relevant no matter where you are, whether you're in another province or in another country. I think some of these considerations are relevant. Um, yeah, so I'm gonna go ahead and share my screen and get started. I think I'm going to an intrepid little virus invaded my sinuses a week and a half ago. So I'm going to turn my camera off when I share my screen and go through the slides, and I'll turn it back on again after so we can, if anyone has any questions. So I'll do that now and get started. I think everyone can see my screen. So let's get to it. What is policy? What are we talking about when we say policy? I know when I first started in the provincial government in Newfoundland, it was in a policy position, a program and policy development specialist. It was a term that I don't think I could have well defined it in my first 6 months of being there. In the simplest way to think about policy is to think about it as a plan or a course of action. So there may be a problem or an issue, and a policy is oriented toward the solution to that problem. We can think about policy development then as the process of taking an idea and just transforming it into an action. So in health, what are some examples of policy that when a government announces that they are going to build a new hospital or close a hospital, those are policy decisions. When your government announced that the flu shot was going to be publicly funded, that was a policy decision. And I believe they're publicly funded in most provinces in Canada. In Ontario, OHIP, the Ontario Health Insurance Plan, that's a comprehensive plan of medical care insurance that covers the cost of physician services for people in Ontario. That was a policy decision. In Newfoundland and Labrador, our prescription drug program that provides financial assistance for purchasing eligible meds for people in the province here, that was a policy decision. Governments commit publicly to policy directions with things like framework documents and strategic planning documents. In our province, for example, in 2017, our provincial government released a policy document called Towards Recovery, a vision for renewed mental health and addictions system for Newfoundland and Labrador. So that document provided the direction for mental health and addictions policies and programs in our province for 5 years out. So how are public policies then made and changed, and can your research influence that? Excuse me. Policy influences will come from both inside of government and outside of government. Within government, deputy ministers and assistant deputy ministers, policy changes may come from their ideas. There may be an evaluation of existing programs, existing policies, or policy reviews. In a number of Canadian provinces, there are health quality council type entities that are responsible for monitoring and reporting on health quality outcomes in their provinces. Those came about as a result, at least in part, of policy reviews. Changes in government structure can influence policy. If a department loses branches or if departments are joined, that can cause policy change. Policy changes for financial reasons. Analysis of expenditure and revenue trends can lead to policy change. Outside of government, there's a number of influences on policy. The public influences policy through their concerns, right? They send letters, there may be media coverage. Researchers may approach decision makers with evidence that challenges current policy and leads to change. There may be lobbying from different interest groups. I know in recent years in our province, groups started calling for government to legislate mandatory staffing in long-term care homes for seniors because of issues around safety and care concerns. Technological advances can also influence policy change. And often there's overlap where there's more than one influence acting at the same time. So, for example, new technology combined with public concerns around accessibility and appropriate care for people with mental health and addictions issues, that can spur investment in things like remote monitoring for mental health initiatives. And always, always present is the election platform and political will to implement change. So how do policies develop and change? Often policy changes require a decision of cabinet, which is the executive branch of government that's made up of ministers. So the policy proposal is written as a cabinet submission. And that's where a policy professional will demonstrate their analysis of whatever the policy issue is and seeks approval for some recommended action, some recommended direction. The policies laid out in the documents laid out in only 5 pages, in a very specific format, and follows a timeline. And the draft and the document and the drafts are kept confidential. But cabinet approval is not always required. For direction on existing policies and programs, a briefing note may be sufficient for approval by the premier or minister or some other executive member. That's a shorter document, 1 to 2 pages, a written document that specifies the decision or the direction that's required. It also gives a brief background and a current status of the issue, and gives an analysis of the recommended direction and alternatives. Now, a general rule of thumb is to look at whether or not a policy change falls under the minister's authority. So there's no new funding required, there's no legislative changes, no increased burden on stakeholders. So you look to relevant legislation. If it does fall under the minister's authority, then cabinet approval would not be necessary. If it falls under authority of the lieutenant governor, cabinet approval would be required. So think any decisions that involve new funding, amendments to acts or regulations, making board appointments, proposals, any proposals with other major policy implications. Now, in lean financial times, like we are here in Newfoundland and Labrador, more decisions are being sent to cabinet for approval. And you might think, why should you care about this? Well, from a health services perspective, a health services research perspective, it's helpful to know that some change requires a timely cabinet process. And it's also good to know that whether or not cabinet approval is required, research and analysis is required for ministerial or other executive approval of a policy direction. So I'm going to talk about the policy process or the policy cycle and all the things that must be thought through when developing a cabinet submission. And understanding the process and the things to consider throughout this entire process can help frame your own policy documents when you're thinking about how to communicate your research to decision makers. And let's say your research can lead to policy change. If that change requires cabinet approval, then all of the things in the cycle will have to be thought through. So you might as well do as much as you possibly can upfront. This image was modified slightly from Policy NL's website. That's a great resource for policy related questions. Policy development moves through a number of stages, issue identification and definition, to policy research and analysis, to generating solutions and alternatives, to developing the proposal, to implementing, and then evaluating. And running through the entire cycle, you have consultations with key stakeholders and a number of things to consider as you work through policy development. Now, these stages are not mutually exclusive, but the policy cycle provides a really good framework for discussing the process. So let's, excuse me, let's walk through a hypothetical situation. Right now, you are a policy professional in the Department of Health and Community Services in the government of Newfoundland and Labrador. What is the problem? We want to be sure that the problem is clearly defined, to be sure that we're indeed targeting the right problem and therefore not misallocating resources. So in Newfoundland, excuse me, a local research group approaches your Deputy Minister of Health with really high quality research findings that reveal many adults in the province, age 18 to 64 years old, they're not hitting the Canadian physical activity guidelines for exercise. Now, exercise, we know, has many health benefits. So the Department of Health and Community Services is developing a new policy on exercise for adults. What's the desired outcome? The goal is to increase the rate of exercise and reach targets for recommended exercise. And the long-term goal is to improve health outcomes like decreasing chronic disease, type 2 diabetes, coronary heart disease, stroke, etc. Now, this aligns with our previous government's main policy document, the Way Forward commitment, that by the year 2025, Newfoundland and Labrador will increase its physical activity rate by 7%. Now, the current provincial rate of physical activity is around 48%, and this 7% increase will get our province, will allow our province to surpass the national rate of 53%, around 53%. So the policy research and analysis piece of the cycle, this is where policy professionals like you right now work to understand the problem and develop solutions. So we need to think about context. In Newfoundland, what are some barriers to exercise? Things like access to fitness facilities, poor weather, lack of time, lack of social support, lack of knowledge about exercise, potential costs of exercise. What would facilitate exercise? Who are the stakeholders? The public, patients, family physicians, exercise professionals. Is this problem province-wide, or is it only in some areas? Is there something different about the areas where physical activity is higher? What data is available to understand the problem? Has the issue been consistent over time, or has it gotten worse? Is this a problem that affects underrepresented groups more than other groups? Are there legislative concerns to address? What acts or regulations would give legal authority for this? How will personal information be protected? Are other jurisdictions having a similar issue? Are there initiatives to increase physical activity for adults in other provinces or other countries? Have they been successful? What challenges do they face? Is any of this relevant in our context? Once there's a comprehensive understanding of the problem, as a policy professional, you come up with solutions. So let's say you find that the biggest barrier is weather. More people are not meeting exercise guidelines because it's just too foggy and rainy and windy, so people won't get outside. What are your options? Well, option one, everything stays the same, maintain status quo. Now that isn't recommended because physical activity then is unlikely to improve. Option two, buy every adult in the province a pair of rain boots and an umbrella. Now that might help people decide to exercise outside more, but it doesn't remove the problem of weather completely, and it certainly doesn't take into account other barriers. Option three, the recommended course of action. The Department of Health and Community Services will fund a membership to a fitness facility for every adult in the province. And in areas where there are existing facilities, They'll get a free membership. In areas without, government will build facilities. Now, there's a lot to think through, right? This will be piloted in one region of the province first and assess the outcomes before rolling it out province-wide. So where would the pilot happen? In order to generate solutions, you have to bring things back to stakeholders, talk to the public, to family physicians, to exercise professionals, to other departments like, for example, the Department of Tourism, Culture, Arts and Recreation. We could think about, you need to think about who might be negatively impacted and how to address that. If government were to go to tender at a large gym like Good Life Fitness, say, were to get the contract, then smaller privately owned gyms may suffer. But smaller gyms might not have the capacity for a large intake of clients. Who might be helped? What about other groups? Children, youth, and seniors. We also need to think about the costs associated with alternatives and the recommended option, and justify spending on the recommendation. Now, in Newfoundland, our government follows a zero-based process, so all expenses have to be justified for each new period. And under that approach, departments have to build their budget request from zero and justify any continued investment in all areas of operation. So then recommended options that fall outside of government's priority areas become a really hard sell. Now, as you gained an understanding of the issue and thought through the solutions, you engaged in consultations. That happens throughout the policy development process. You need to think about how much time and how much money, how much staff do you have to carry out consultations? Who would need to be consulted? The general public, family physicians, exercise professionals, other government departments, etc. These are the people who are going to help clarify the issue and inform the recommended solution. What are you going to talk about in consultations? What are you trying to achieve through them? Are you trying to generate options or determine outcomes? When will you hold consultations? Think about if you'll do them at all steps in the policy process or more so in the beginning as you're trying to understand the problem. Where will they take place? Will they be face-to-face? Will some happen over the phone or online? Will they be one-on-one? Would a group setting be better? Why do they need to be consulted? Are you trying to get information about the issue or get feedback on your proposed solutions? You may want to talk to family physicians about health outcomes associated with the lack of physical activity, but then you might want to talk to the public about their willingness to use a free exercise facility. What should it include? What should its hours of operation be, etc.? What form will those consultations take? Will you get a group of fitness professionals together in person or make phone calls? Will you invite members of the public to like a town hall kind of a meeting, or would you hold smaller focus groups? Will you travel across the province for consultations? And if so, how many will you do? Will you write a discussion paper for feedback from stakeholders? Then cost will likely determine how you go about consultations with stakeholders as well. Consultation findings and your research will then come together in a policy document. You know, I mentioned already about when the policy development change requires cabinet approval, and our example here would require substantial spending and possibly new infrastructure, and so would absolutely require cabinet approval in order to proceed. Excuse me. So your Minister of Health will seek cabinet approval for the recommended option. They'll have to show that all feasible options have been examined and that implications for implementing and the impacts on stakeholders, that they're all fully explored, and that all information pertinent to making an informed decision is present. So when you think about the fact that a cabinet paper must be no more than 5 pages, that's not an easy task. So cabinet approves the policy direction. Now it's time to implement. The policy is going to be implemented as a pilot in St. John's, and government is going to give a free membership to fitness facilities in St. John's for a specified period of time, evaluate the effectiveness, and then roll it out to the entire province. So think through implementation issues. Think about who will be responsible for what. What resources are required to implement? How will you get performance data? And then you do it. Once you implement, you want to determine if it worked. Now, this is another area where researchers may fit in. So if a policy shop doesn't have capacity or expertise to evaluate, then they will contract that work out. Are adults in the pilot reaching the daily recommended amount of physical activity? What performance data will you need to evaluate? Will you look at whether or not there was an increase in the number of people using facilities, an increase in the amount of time spent exercising, a change in intensity of exercise, satisfaction with the program? Know what you want to measure and lay out a plan to do so in advance. And also know what resources the evaluation will require. This then feeds back into the program to help improve it before rolling it out to the entire to the whole province. And that, in general, is how the cabinet process works. So all that happens within government to make and change policy through cabinet. Your research could initiate that process. It could inform a portion of it. It could also impact change without going through the cabinet process. So with Quality of Care NL, we've had an implementation team in place to help frontline staff change business processes to decrease recovery time after a particular type of surgery at one of our city's hospitals. And we have a team working on electronic decision support tools and electronic test ordering to reduce wait times and facilitate tests for people who really need them. Now, during the policy cycle, there's a number of considerations that happen all the way through. And whether or not policy change based on your research would require cabinet approval, the considerations are still the same. So as you prepare policy documents to communicate your work to decision makers, keep these things in mind and incorporate them wherever you can, if it's feasible. Excuse me. So that described what happens as a policy professional working in government. So let's look at policy documents now from a researcher's perspective. So you've done some high quality research and you want to communicate its potential on one of your government's priority areas. Policy documents need to be brief and to the point. So simply put, you're saying, this is what we want, this is why you should give it, and this is how and when we'll make it happen. And there are a number of considerations that should be included if it's feasible. And these are important things that policymakers will likely look for when reviewing proposals. So it's best to include it all up front to show you've thought it through. They'll likely request some of this information upon reviewing the document. You want to give a statement that defines the issue. What is the issue or problem? What issue or problem is the proposal or piece of research addressing? What course of action are you recommending? What are you recommending to address it? What are you asking of government, and who's going to do it? You want to provide a brief background on an issue. Give some context, but not too much history. You want to focus mostly on the issue at hand. Why has the issue arisen? How is it currently being addressed? Also, how does your recommendation map on to current horizontal initiatives or priorities of government? How does it map on to any departmental strategic plan or budget documents? Can you link it to anything in government's estimates document? Are there any other initiatives that this could facilitate or implement? Can you tie your ask to a publicly made commitment? Does it support current government, right? If it falls outside of current government priorities, it's going to be a harder sell. What is the current cost to the province? Give any pros and cons of proceeding with your recommendation. Think through other options or alternatives and explain why they might not work. So using evidence, outline the impact of not doing what you're recommending to the people of your province, impact on the economy, etc. What is the cost to the province to implement the implementation? Where will that money come from? Is there money available elsewhere? Like, is there any federal funding, for example, that could be leveraged? Has there been an economic analysis you can share? Are there any financial implications to other areas of government or other departments? Are there savings as a result of the initiative? Can you quantify decreased costs in the long term? It is highly likely that any new funding request that's not in the fiscal forecast may be a harder sell and will most certainly be scrutinized. We need to think about service delivery. How will this happen? And human resource requirements. What are the staffing requirements? Are there any safety considerations? So in our example, how would safety concerns around exercise be addressed? Are there any legal or legislative implications to implementing? Does what you're proposing require any legislative change, or what acts or regulations give legal authority for creating or changing policy? So for example, the health quality councils in other provinces, they each have their own act that give them the power to carry out their mandates, which include health system performance and reporting. Has any consideration been given to how will privacy concerns or how will personal health information be addressed? So in our province, personal health information is protected under the Personal Health Information Act and HIPAA. What about any amendments to an act? Will that be necessary? You want to briefly describe any relevant experience and successes of other jurisdictions who have implemented something similar. Do others have a similar issue that they're trying to solve? Are we leaders in this area, or are we lagging behind? Do they have relevant legislation? What is the impact of your proposal on other departments? Have you consulted with them? What do they think? And how will you address any concerns they may have? Are there any federal or provincial implications? Is there federal support? So using our example of increasing physical activity, Health Canada released a national policy in 2018 called Let's Get Moving. That's a vision for increasing physical activity and reducing sedentary living in Canada. So what we've proposed maps beautifully onto that. Are there any impacts on the environment? This may be relevant with any infrastructure changes like building construction. Does your initiative have any rural implications? Is it province-wide? Does your initiative have any gender implications? Is the impact the same for men, for women, for those who do not gender identify? Does your initiative have impacts on Indigenous groups? Describe consultations that have occurred to reach your recommendation. So patients, the public, other departments at Memorial, other provinces, professional associations, and so on. Like, what are the opinions of the relevant stakeholders? Are there any concerns? And if there are, how will you address them? Who's your target audience? How will this be shared with the public? What will their concerns be? Are there any arising issues? Are there any political considerations? And if so, how will those be addressed? In addition to all of that, there are a few things to keep in mind when communicating your work to decision makers. You want to be brief and very clear about your purpose. So you want to avoid writing in technical language and write plainly. It's often helpful to include a short executive summary that captures the very main points. And sometimes infographics can be useful as well, depending on the topic area. So can your research lead to policy change? Well, it certainly can, and it should be high quality, relevant, and accessible. I think it's important to know that policy development it's not a linear process. It's very complex with many things happening at the same time. There's many moving parts and people involved. But there is a formal process, and understanding that can help know where and when your research could be most useful and have the most impact. And I've got here some resources, some policy-related resources that may be helpful. And my contact information is here as well. If anyone would like to reach out at any point or has any questions, we can have a chat now, or if you have any questions, that's great. Like I said, I don't consider myself an expert, but I certainly know people who are and can reach out for answers if I'm unable to get them for you today. So I'm going to take my slides down now.
Thanks, Cheryl. That was a very informative presentation. Does anyone have any questions or comments?
It's Mike Warren. Can I offer a comment?
Sure.
Cheryl, one of the things that and I have a policy background, you may know that, but one of the things that I think is important to note is the role that Cabinet Secretariat plays. You're not alone in this process. They guide you through the process, and they're an excellent resource to assist in the development of policy.
Yeah, absolutely. You're right, Mike. Mm-hmm. I'll also say, you know, as after everything that I just talked about, there are times that all this goes right out the window when it comes to policy, right? So like we've just experienced that with the with COVID-19 and public health emergency. So things are put into place and government takes action in those cases without this process, right?
If I could make another comment, unless there's other questions or comments, is that a critical and a fundamental part of all this process is don't mislead Cabinet.
Oh yes.
You risk your career,
Yeah.
and it's very important. That's why I guess it's important to have the experts with you and as part of your own work to do the analysis. But the process of going through government and converting the cabinet paper,
Yeah.
that's the process you use, into policy. It's important to involve all the folks that can contribute to that, because cabinet really wants to know. And the idea, I think the expression is truth to power. And that's your role in this case, I guess, as a researcher, providing the background and the information, also as a public employee, to do an honest evaluation and provide an honest and clear, concise recommendation to cabinet, because they deal with lots of stuff. And you're right, you have to boil it down.
Yeah.
And that's a skill in itself.
It really is. Yeah, it really is. And there's a tremendous amount of work that goes into all these pieces, and to boil it down into 5 pages is that is quite a skill. Yeah.
Any more questions or comments? Okay, well, if there's no more questions or comments, I just had something to share really quickly. So as most of you already know, we have an ongoing research design series, which Cheryl just participated in. We are in the process of getting some set up for June and then September and October. So you can go to the NL support event page to register, and you can actually check out past events, including this one. That'll have the slides and recordings available. We have a free training program available, so it's open to anybody. It's monthly webinars. You have to attend 6 sessions and you will get a letter of completion. So in order to sign up for that, you got to go email nlsupport@mon.ca. And if you have any questions about the training program or webinars, you can contact me at amy.hand@med.mon.ca. So that's all I had to say. So if anyone doesn't, oh, there's a comment. Excellent presentation. Thanks so much for giving your time to share your expertise, Cheryl.
Thanks for being here. Time, I know how precious time is, so I'm glad that we could share it together. Thank you.
Oh, and everybody's saying thank you for your great presentation. I don't know if you can see the comments.
Thank you. Yeah. And you have my email address, so if anyone has any questions or wants to reach out or just have a clarification of anything that I might have said today, feel free.
Selena asked, will your slides be shared? They will be on the NL support website once the recording is uploaded.
Great.
Thank you so much.
You're welcome. Thank you.
Okay, thanks. See ya. Thanks, Cheryl.